Hi, everyone. I'm Jocelyn Hillard with the American Red Cross. I am the Regional Communications Director for the Connecticut and Rhode Island region, and I am so excited for you to be joining us today and for what's to come. Today, we're shining a light on sickle cell disease, a condition that disproportionately affects the Black and African American community. The Red Cross is working to make a real impact by increasing access to life-saving donations and expanding outreach in communities that are most affected. I am joined today by two amazing guests, Dr. Cecelia Calhoun, Assistant Professor of Medicine at Yale University and Medical Director of the Adult Sickle Cell Program at Smilow Cancer Hospital in New Haven. She also serves on our American Red Cross Connecticut Board of Directors. I'm also joined by Koby Langley, Northeast Division Vice President for the American Red Cross, who brings professional insight and deeply personal connection to this issue through his own family's experiences. Thank you both for being here. So the first question, I will turn to you, Dr. Calhoun. Let's start with the basics. What is sickle cell disease, and why is it so critical for people to understand its impact, especially in Black, African American, and Latino communities?
Absolutely. So sickle cell disease is an inherited disorder, so something that you're born with that affects our red blood cell, which is what carries oxygen throughout our bodies, keeping our tissues healthy. When you have sickle cell disease, I always say a normal red blood cell is kind of shaped like a jelly donut. It's really squishy, able to take oxygen where it needs to go. But when you have sickle cell, instead of being shaped that way, it's shaped like a donut, excuse me, like a banana or a crescent or a sickle, which is why it's called sickle cell disease. And so not only is your body not able to get the critical oxygen that it needs, but also those cells are quite sticky. They stick to one another. They can cause inflammation and cause really consequential organ damage like pain and affect any organ in the body. To your question about importance for in the African American community, sickle cell is an evolutionary trait that protects us against malaria. So anywhere where malaria is endemic and people are descending from those areas, sickle cell continues to persist. And so it's important that we understand that this protective mechanism in different settings can have deleterious consequences that we can treat with blood. So.
It's wonderful. Thank you. And you explained the science behind it, the history behind sickle cell disease. But Koby, I'm going to ask you that understanding the human side of the disease is just important as the science. So I know this issue hits close to home for you. So would you be willing to share how sickle cell disease has impacted your family and shaped your perspective?
Yeah, absolutely, Jocelyn. It has impacted my family, but it also impacts, 1 in 365 other African American Black families around the country. It's pretty common in the African American Black community, as Dr. Calhoun mentioned. But yes, my uncle did suffer from sickle cell disease. He was, born and raised in Texas. My grandmother and mom and other siblings were principally the ones that were his caregivers. Frequent hospital visits, pain crises. It takes a lot of emotional toll on everybody that's involved. Oftentimes, when I get a chance to visit him, he is one of my favorite uncles, right? He's the fun uncle. Seeing him, suffer in that way was traumatic. I was pretty young at the time. He passed away due to complications from this disease and some other health-related issues. But these are kinds of issues that most families that have a person with sickle cell in their family deal with, and they deal with them pretty regularly. Frequent visits to the hospitals, unexpected crises. These things can come on very, very quickly, so it makes it very difficult to plan. It makes it difficult to travel. You want to make sure that you have access to adequate health care. Oftentimes, because these pain crises are difficult to communicate, sometimes you would have challenges in explaining this to a healthcare provider if you were not in a place where you were normally treated. There's obviously some pretty significant health disparities already in African American Black communities, in America and elsewhere around the world. And these health disparities obviously can kind of exacerbate the experience. So sometimes you find yourself also fighting with the healthcare system, and trying to explain these crises on behalf, of your loved. So yeah, this is an incredibly painful experience for everybody involved, but particularly for the patient. Oftentimes, my uncle, when he would describe it to me when he was having a crisis, he explained it as drowning while glass was running through his veins. That's kind of how he explained, the pain and the intensity of it. And more times than not, he would make it through it, and we get into the hospital, and things would be okay. Or my grandmother or the caregiver would get him to the hospital, and he would be okay. But yeah, it's a very, very challenging disease, and those trips to the hospital can be quite frequent, monthly. And if you have a particularly bad month, it can be, weekly, going in for blood donations. But these sickle cell warriors are strong, as was my uncle, and they're also very inspiring. And when I think about the time that I did have with him, I usually think about, his strength and his joy. He was a very funny guy, and he could fight right through that pain and come back the next day and be himself. And these are treasured memories that I have of my uncle, but it also reminds me, every day that there are other families that are going through the struggle.
Thank you for sharing your story, and it's such a powerful reminder of why we do this work. Koby, you touched upon the complications and what that might, some of the challenges that patients face. Dr. Calhoun, do you mind expanding upon that? I know that you work so closely with patients every single day.
Sure. And Koby, that was such a concise but deep and good explanation of kind of what my patients explained to me. And so thank you for sharing that. So we talked about the sickle cell affects the red blood cell. So anywhere that blood goes, sickle cells will go there and cause damage. It could affect any organ in our body. When oxygen isn't being delivered properly, that organ can't survive, whether it is your kidneys, whether it is your lungs, like acute chest, which is like a pneumonia and some sickling in the lungs. One of the things we really are learning a lot about across the lifespan is how sickle cell disease affects the brain. And we know that it can cause strokes, which I don't think a lot of people recognize. We know about the pain, but we don't always know that children with sickle cell disease are having strokes. And the way that we, number one, prevent stroke in sickle cell and prevent a second stroke if someone has had a stroke is through regular blood transfusions and red blood cell exchange. We don't have a lot of therapies to treat actual sickle cell. Many of us know about treating the pain with opioids or maybe other types of medication. But really, the only medication that's FDA approved to treat sickle cell itself is hydroxyurea, which was FDA approved in 1998. Other than that, besides our curative therapies, we're treating downstream consequences. And so when we really need critical rapid intervention, or when we're trying to prevent organ damage, we rely on blood transfusions and red blood cell exchange.
It's amazingly informative. So you thank you so much for sharing. So you mentioned life-saving blood products, and certainly here at the American Red Cross, we are focused on saving lives through blood donation. And both of you have shared your stories, but also how that might impact someone with sickle cell disease. So I'm going to ask you now, Koby, in addition to providing life-saving blood for patients with sickle cell disease, the Red Cross also supports broader health needs, like sickle cell trait screening, mini health assessments for donors, and even A1C screenings through public health partnerships. How is the Red Cross using these tools to help address health disparities in underserved communities?
Thanks for that question, Jocelyn. I think this is really important because the American Red Cross, a part of our mission is to alleviate human suffering. And this is a disease that causes a lot of suffering, as we've discussed. And, by integrating the testing into our blood drives and community events, particularly in underserved areas where access sometimes to this preventive care is limited, the work of the American Red Cross basically has a double benefit, right? It helps sociologically in that it addresses some of these health disparities that are rooted in systemic issues like poverty that can lead to higher rates of chronic conditions in minority communities. But it also improves health outcomes for the entire communities, right? At scale, theoretically, it would even reduce the healthcare costs for those communities when you are able to provide this testing and screening, and people are able to get treatments early and into healthcare systems early. So, for instance, through our sickle cell trait screening, we empower donors with knowledge about their health, They may not know that they have this really unique trait in their blood, and they can donate blood to help, tackle this important issue. Many health assessments like A1C screenings to help identify risk for diabetes and other issues early on. We know that by identifying A1C issues early on, you can change your diet, improve your exercise. These are largely, I'm not the doctor, Dr. Jocelyn, Jocelyn, I just want to be clear, Dr. Calhoun is a doctor here, but I will say, also having a lot of folks in my family that have these issues, these are things that can be prevented if you find them early on, right? But ultimately, they foster trust and engagement in communities that have been historically, challenged in receiving good health care. And, I'll say that just here at the Red Cross alone, the Sickle Cell Initiatives provided more than 300,000 sickle cell trait screenings since its launch. So it's touched 300,000 patients, 300,000 families, 300,000 members of your community and my community, raising awareness, helping that we have better health management and hopefully better health outcomes in these impacted communities.
If I can, I'll just add, you don't have to be the doctor. I think the majority of the work I do is in partnership. And I think to your earlier comments around the majority of the time, the patients that I serve, they're with their family more than they are with me. They're with their community. And so being able to impact those communities certainly has very quantitative benefits, but also that qualitative, unseen, hard to capture benefits as well. So we work together.
So why is it so important, Dr. Calhoun, to have a diverse donor base for sickle cell patients? And what does that mean in terms of treatment outcomes? I know you touched upon that a little earlier, but anything else maybe you believe we should be added to this conversation?
Sure. So earlier I talked a little bit about how sickle cell is protective against malaria and trait and other types of disorders that affect the hemoglobin in that way can be in places where malaria is endemic. And so when you have populations like African Americans, Africans on the diaspora, who are in other places, oftentimes we can also have very special differences in our blood antigens. So we all know our blood type. I'm B positive. Surprise, surprise. If you don't know, you can get tested at the American Red Cross. But sometimes we have what we call minor antigens that can impact how a person is able to receive and hold on to red blood cells. And they can be different in different ethnicities. And so it's important to have a broad base of ethnicities in the donation pool because, like I said, regular blood transfusions are preventing children from having stroke and sickle cell. And so we want to make sure that we have the right product for the right person, that we have it so that they can receive it. There's nothing like being a hematologist and navigating a blood shortage. So making sure that we have the right diverse donor pool with a lot of different ethnicities to represent those minor antigens so that we can treat people with what exactly is it.
It's wonderful. And I'll also add that, when individuals are coming out to donate blood, there is the opportunity to also identify yourself and how, and that helps us with our evaluation of blood product as well here so that we are able to make that closer match potentially and work with our teams and medical directors to help support our hospitals with your blood donation. So it's just so important in so many different ways that we're kind of raising awareness around why it's so important that we have a blood donor base. And so speaking of partnerships, Dr. Calhoun, you mentioned that a little bit earlier. And I think it's so important to underscore again. So can you share some of those specific programs or partnerships the Red Cross has launched through the Sickle Cell Initiative to increase awareness and support patients? And that's for you, Koby. I apologize.
I was like, I could.
Of course.
Yeah. Well, Dr. Calhoun is a great partner. She's on the call,
Sure.
sharing this important message with us. And I would say healthcare partners, like Dr. Calhoun, are critically important to our partnerships. But we've also rolled out targeted programs in order to boost awareness and support. These initiatives reach into community influencers to help educate them about this really interesting, aspect of sickle cell disease. So as Dr. Calhoun mentioned, because the disease originated from sub-Saharan Africa in a really interesting way, right, in order to fight another disease, but in different settings, it's very problematic. And those communities, mostly, African American and Black communities, when their families are struggling with this disease, some of them don't know that although this is a disease that disproportionately impacts African American Black communities, it's also a disease that can be fought more effectively by African American and Black donors, blood donors. And most people didn't. I didn't know that, until I was well into my 40s. I didn't recognize that this aspect of the etiology of the blood, actually can help fight the disease. So, collaborating with organizations like the Sickle Cell Disease Association of America to talk about educational events, to explain to people that you may have this really unique trait in your blood that can help fight sickle cell, these sickle cell attacks better. We provide them with free sickle cell trait testing at blood drives, campaigns to recruit diverse donors that are more likely to have this really unique trait in their blood that can help combat the attacks. We work with faith-based groups and community leaders to reach sometimes difficult to reach areas. This initiative has inspired more than 140,000 first-time African American blood donors. So it's bringing a new population into the blood donor base, and in a space where we're seeing demand increase, 4% on a year-over-year basis. As many blood donors as we can get into the system, the better for everybody. And it helps us to also engage them in conversations about, potentially, other health issues that they might be experiencing, through some of these free screenings. We also partner with HBCUs. We've partnered with the Divine Nine. I was just in Atlanta recently with a good friend of mine, Micah Holloman, who's leading some of the outreach and engagement initiatives. And he challenged these HBCUs leaders to go out and host their own blood drives and to educate their own communities. So it truly is an all-in event from a community perspective.
So Dr. Calhoun, we know you're a medical doctor. We know that you are so passionate about this program, but we know you're also a human first. And what gives you hope in the work that you're doing and the fight against sickle cell disease?
Sure, absolutely. So, fundamentally, it's the patients that I see, like when I'm in clinic, seeing them navigate challenges with resilience and success. We refer to people with sickle cell warriors for a reason.
Mm-hmm.
And so I think at the very center, they remind me each clinic, to continue to persist, that there's a reason and a critical importance behind this journey and the awareness that we're trying to bring towards our communities. I just appreciate that work that the Red Cross does and the opportunity to speak in a platform like this, because sickle cell disease can be a silent disease. You can't look at somebody and say, oh, you have sickle cell, or oh, you're in pain, or you're not in pain. And so the more people that we educate, the more people that get understanding and have empathy and compassion, who also bring their talents and their knowledge to this field to find solutions, those give me hope as well. And then, I think our scientific community is making some real investments as we think about how do we cure sickle cell disease, and how do we not only develop cures, but get them to the people that they need to be at. And so it's a very fertile and exciting time. And I continue to remain inspired by my patients, my colleagues, and our larger community.
Thank you. And we continue to remain inspired by you. So Koby, to help us kind of close this out, for those watching or listening, what's one action that someone can take today to support the Red Cross's mission and help those affected by sickle cell disease?
Get tested. You go in, get screened. Get your free A1C screening as you're donating. We'll test for the tither in your blood. Encourage people to go to redcrossblood.org or to download our app. The really cool thing is when you donate blood for the American Red Cross, you can actually see the impact that your blood donation is having. We'll tell you kind of where your blood went and when it was used in a hospital setting, so you actually know that your blood went to a patient. It's a really impactful way to give back. This helps us, fight health disparities. It helps strengthen social solidarity in communities. And just one patient with sickle cell disease can require up to 100 units of blood each year to manage these complications. So every donation is really critical and can help save lives, and help us in the American Red Cross alleviate human suffering. So, yep, redcross.org or redcrossblood.org. And please sign up for a blood drive. Encourage your friends to sign up for a blood drive. Get educated, particularly about sickle cell disease and what it can mean for the African American and Black community and the unique ways that we can come together to help combat it.
Thank you so much. That was a very nice way to close, Koby. So thank you so much to Koby Langley and Dr. Cecelia Calhoun for sharing your insights, expertise, and personal stories. Today's conversation highlighted the ongoing need to raise awareness, compassion, and importantly, action. So you two both did a beautiful job of educating us on both the personal aspects, the impacts in our community, and what we can do to help make a difference. So I'll underscore again to get more involved, whether it be through blood donation, volunteering, really spreading the word. Visit redcross.org, redcrossblood.org or redcross.org to learn more, and together we can make a difference. So thank you both again so much for joining us today and for all that you do.
Thanks, Jocelyn. Thanks, Dr. Calhoun.
Of course.